Hello, everyone. Welcome and thank you for joining us today for Session 3 of the MIPS Promoting Interoperability 2020. My name is Sharon Phelps, and together with my colleague Miranda Brzezinski, our session will focus on how to complete data submission for the requirements and measures of the MIPS Promoting Interoperability category for 2020. Miranda and I both work for Mountain Pacific Quality Health, and the Queens ACO quality team has contracted us to help you be successful in submitting data and reporting for promoting interoperability. I will be referring to this as the PI category throughout our session today. Due to your participation in the Queens ACO, the Promoting Interoperability category is treated a bit differently than for those folks that are not part of an ACO. So if you are involved with a different clinic that is not part of the ACO, what I'm going to go over today is a little bit different than it would be for that clinic. I just don't want there to be any confusion. Okay, let's get started. Here is our agenda topics for today. We're going to go through all angles of reporting. A few important things as we get started. Joining us today from the Queens ACO quality team is Jade Hinsdale, Stephanie Nobriga, and Kelsian Oshiro. We also have Laura Hazenfield from Queens joining us today. So thank you. They are going to be our knowledge bank for any questions you may have that regards to Queens and the ACO. Next, this session is approved for CMEs. When the session ends, you will get a pop-up evaluation to complete to get your CMEs. The evaluation will also be sent out again tomorrow. For those of you that are not interested in CMEs, we would love it if you would complete the evaluation as well, because that gives us important feedback on how to improve our presentation. You will be getting the slide deck and the recording after this session. It'll probably be a day or two before you get it, but that will be sent out. And the Queens team will be mounting that on the website, so it will be available for you for reference down the road should you need it. Lastly, please let us know today, either in the question and answer, under the question and answer button at the bottom of your screen or in the chat box, if you have questions. Our goal is that you understand this when we are done with this session, and we are happy to take your questions to make sure that you know what's needed to be done. Okay, our first topic of the day is going to be talking about what you need to do to prepare to get ready for submitting the data in the PI category. The reporting period opens January 4, 2021. So you can't submit the data yet, but you can certainly get prepared. So when that window of opportunity to submit the data opens, you're good to go. Okay, first thing. When you submit the data, you need to be able to tell CMS what EHR system you are using. The mechanism that you have to do that is an ID number that CMS has applied to every certified EHR system. Each system has their own number. So there is a website right here. This goes to the Certified Health Product Listing, otherwise known as the Chapel site, and you can look up your EHR vendor, your EHR platform, and you can find that big long number that is the certification number for your system. You can also ask your EHR vendor if they have that number for your system, and they should be able to give it to you or help you get it. For those of you that are using the Epic system from Queens, they're going to be able to help you get that number. Next, before you actually enter any data into the system on your performance results, you must complete the attestation statements that you have completed a security risk assessment and that you agree to no information blocking and that CMS can review stuff in your system if needed. So those are important things to do. I want to stress about the security risk assessment. If you have not yet started that, there is still time to get the security risk assessment done, but you don't want to delay any longer. So if you have any questions on that, let us know and we'll steer you in the right direction to be able to get that done. You don't have to report anything about that. You just have to do it. Another critical thing that you can do right now to get ready is to look at what your performance results look like. If you have a 0 in the numerator or the denominator of any of those performance measures that need to have a number, you need to be talking with your EHR vendor to ensure that that is accurate data versus something's not set up in your system right. Because you want to make sure you have data for those measures. If you don't have data and you cannot take an exclusion, you're going to get a 0. And if you get a 0 for that measure, you get a 0 score for the entire category. Okay, the next thing you can ask your EHR vendor about is how do you get your hands on an uploadable report to report the data for the PI category, or where should you get that information from if you are going to manually attest to that data? And if you manually attest, you need to keep a copy of a report for your audit folder in case CMS audits you. So it's good to talk with your EHR vendor to learn that. So for the clinics that are using the Epic system from Queens, they are going to give you a form that you are going to fill out to tell them all sorts of information about obtaining your data. And to help you out, we actually have in Appendix B of this slide deck, we have an example of what that form looks like. We're not going to go into detail on that because it may not pertain to everybody, and we don't necessarily have time to do that much of a deep dive, but it is there in Appendix B if you'd like to look at it. For those clinics that don't use Epic from Queens, you need to have a talk with your EHR vendor and ask them how to run what's called a QRDA3 report, and we're going to talk about that in a little bit. Or how do you capture your performance results so you can report them and you can keep them for your audit folder? And they should be able to walk you through how to do that. Another thing you can ask your vendor about is, can you review your data at the group level versus the individual level? Because sometimes you can get a better score doing one versus the other, and we'll talk a little bit more about that. And remember, this isn't just about getting the highest score for the sake of getting the highest score. That score translates into a positive payment adjustment for the entire ACO. So you can contribute towards everybody getting a better payment adjustment when you have a strong score. Okay, let's talk a little bit about the difference between group versus individual reporting. If you report as a group, you're going to report all of the data for the PI category for all of the patients, for all of the MIPS eligible clinicians by clinician type for your clinic. And CMS defines your clinic as TIN level. So if by chance you have 2 TINs, you would report for 2 groups. If you only have 1 tax ID number, only 1 TIN, then you would only need 1 report. It would contain the data for everybody, and you submit that 1 report. Individual level reporting is when you report 1 set of data for each individual, provided this individual has not been accepted, and they must report. You can, if you need, report at both levels. CMS will let you do group and individual. It'll capture that for you. and then it will give you the best of whichever score. So wherever you're highest, they're going to give you the benefit of the doubt and give you the highest one. I will tell you group reporting is the most common type of reporting just because it's easier, particularly if you have more providers in your clinic. But there may be times when it makes sense to do individually. The next thing you can do is make sure you have access to the QPP portal. The QPP portal is where you submit the data, it's where you review the data, and it's where you can edit the data if it's wrong. So everything is done in the portal. So you want to make sure you can get in there. If you don't have access to the portal, we have a link right there where you can get a document that will walk you through getting access to the portal step by step. This can be a little bit problematic for a few people to get access into the portal, so please don't wait to do this until the day before you're going to submit your data, because if you run into trouble with getting access, you then have that added stress and burden. Excuse me. If you've already gotten access into the portal using what's called a HARP account, log in to confirm that you have access, that you don't need to change your password, that something goofy hasn't happened, and make sure you can get in there. And then make sure you can see information specific to your practice at the TIN level. We want to make sure you can do that. If you can't access the portal or you're not seeing the information for your tax ID number in there, I have included the QPP help desk number here as well as their email address. I will tell you from our experience, when you call the help desk, it takes about 1 to 2 minutes of waiting time, and they can usually answer your question right then and there. They're very helpful. If you send them an email, it takes about a week or two to hear back from them from email because they prioritize the phone calls. So call them. That's tip 1. Tip 2 is that they get very busy once that submission window opens January 4 until it closes on March 31st. So if you wait to call them until mid-March, you're going to have a much longer wait time. And if you run into trouble, all of a sudden you're up against the deadline to get everything done by March 31st. So make sure you have access to the QPP portal now. And if you need to call them now, they're not as busy. It's a great time to do it. The HARP access into the QPP portal is actually a 2-step process. Step number 1 is to get a generic HARP account that it will give you access to other CMS programs or Medicare programs if you have need to go there. We find for most providers, the only thing they're using with their HARP account is to get into the QPP portal. So step 1, get your HARP account. Your HARP account is unique to you, and it's going to do identity proofing with questions only you know. So if you're with a solo practice, like a solo provider, and that provider wants you to sign in for them, they're going to be asking questions you don't know. So you'll need to have that provider sit down, have them get logged in first, and then you can get your own account and they can approve you for that. So be aware of that it is unique to the individual. Once you have successfully gotten your HARP account, the next thing you want to do is you want to associate your HARP account with your practice or your TIN. And there's some additional steps to do that. So you'll know you've been successful with that because when you get into the QPP portal, it'll show you the name of your clinic and you'll know you're looking at your data. So there's a few extra instructions there. You want to make sure the first person from the clinic that signs in gets the security official role, and that you follow the practice staff representative or solo practitioner when they ask you for the role type. Pick whichever of those is correct. There's a number of different types out there because there's a lot of different people that get into the portal. Like, for example, the Queen's ACO they would have an ACO type as opposed to a practice type. So be aware of those items. Okay, next, let's talk a little bit about a couple of terms that are used extensively in the PI category. The first one is exclusion. When you hear the term exclusion, it pertains to a given PI measure, such as e-prescribing or providing patient access to their record. So exclusion is at the measure level. If you are excluded from reporting a measure, it means you don't have to report anything on that particular measure. And we're going to talk more about that in a minute. Exception means you do not need to report in the PI category at all. And there's a couple different ways that that happens. One is automatic based on your clinician type, like PA or nurse practitioner. And the other is you can apply for an exception if you are a small clinic. We'll talk about that more too. So exception is the category level. The third term, exemption, means you're exempt from MIPS as a whole. So for all of you, because you're part of the ACO, that is something that Queens would have to do at the ACO level, and they haven't. So we're not going to talk at all about exemption today. Okay, so let's talk a little bit about how it's been decided who's going to be submitting PI data and who isn't. Each clinic should know by now whether you're submitting data or if you're going to, or you've been given an exception or you're going to take an exception. To help you out, in Appendix A of this slide deck, we have the list of those clinics and providers who need to be reporting. So hopefully we'll have enough time at the end of the session. We can flip there so you can see that list. If you don't know whether you're reporting or not, you need to ask the ACO quality team folks that we have available today, Stephanie, Jade, and Kelson. And we actually have Stephanie's email there. So you can email her if you're not sure whether you're actually submitting PI data or if you're taking the exception. As a general rule, some of the principles that we follow to determine who's submitting data and who isn't, first of all, is clinic size. If you're a small clinic with fewer than 15 clinicians, you can take that exception without any issue. But if you have a really nice high score, that would contribute towards a good high score for Queens, which translates into a better payment adjustment for everybody, they're going to want you to report. That's why they've been asking to see copies of what your actual results look like. So that's kind of how those decisions were made. If you are taking the exception, you need to request that exception in the QPP portal before December 31st. If you don't claim the exception, then you have to report. So just be aware of that. Okay, here's a list of exclusions for each PI measure. I'm not going to take the time to go through all of this. This is a reference slide for you, but if you have a question on whether or not you should exclude a given measure, here's where you want to go take a look to see what can and should be excluded. Be aware when you exclude a measure, that measure is allocated to one of the other measures. So this is a little graphic that shows how, for example, if you are excluded from e-prescribing, half of the points go to health information exchange receiving information, and half of the points go to health information sending health information. So if you just follow the arrows, you can see where things are reweighted. Note that there is no reweighting of the provide patients electronic access. If you report in the PI category, you must have data in that measure. There's no way you can exclude it. Okay, let's talk about the reporting method. There's a number of different ways to report data for the MIPS program. Some of these do not pertain to the promoting interoperability category, so we're going to go through these. First is the Medicare Part B claims that is used only for quality measure reporting for small clinics, and it uses the administrative claims process. It's used only for quality. It is not available for the PI category, so it's not a method you're going to use. The last option, the direct option, is used by third-party intermediaries like qualified clinical data registries, qualified registries, and EHR vendors, and they kind of submit automatically on your behalf. That is also one that's not in use for the PI category, so that one's not available. So that leaves us two options. First is log in and attest. That means you will log into the QPP portal using your HARP credentials, and then you will manually type in the requirement data and the performance results on the PI measures. So you'll need a report that gives you that, or you'll need to view it from a dashboard to be able to put the data in, but you can manually type that in. The second way you can report is called login and upload. Using that method, you log into the QPP portal using your HARP credentials, and then you upload one of 3 file types that the portal will accept. The portal then reads that file type and it pops all of your information in there. You can review it and it gives you your score right there automatically. So login and attest, login and upload are the 2 types, and we're going to talk a little bit more about those next. So the uploadable files, there's 3 types: a QPP JSON file, a QPP XML file, or a QRDA3 file. I will tell you, I most commonly hear people refer to a QRDA3 report, but I wanted to make sure you know there are other file types in case your EHR vendor uses one of those and provides you with that. So QRDA is kind of a strange mnemonic, so let's talk about what that is. QRDA stands for Quality Reporting Document Architecture, and it's just a specific type of report. It's a very highly defined template of what data it contains and how that data is formatted, and it makes it so that the QPP portal can read that report and it can pull that information in. Once it pulls the information in, it calculates your score right then and there. There are a couple different types of QRDA reports. There's categories 1, 2, and 3. The type that you need for the QPP portal is a QRDA3 report, not a QRDA1 report. So if you see QRDA1, that's not going to work. You might use that if you send data to a registry, but you're not going to use it for the QPP portal. So the Category 3 report is an aggregate type of report. It contains all of your data combined together in aggregate, either at the individual level or at the group level. Be aware that this QRDA3 report can also contain quality measure data and improvement activity data, but you are only going to want the promoting interoperability data because Queens reports quality at the ACO level, and they get credit for improvement activities because of being an ACO and all the activities that take place in the ACO. So you only need the promoting interoperability information in that QRDA3 report. If you report at the group level, you're going to have one report for the entire group. If you're reporting at the individual clinician level, you're going to have one report for each clinician for whom you are submitting data. Now, be aware that there may be a measure you're going to take an exclusion for, but the data is going to be contained within the QRDA3 report. Once you've uploaded that report, you can go in and you can mark that you want the exclusion, because you're going to be able to see that data immediately after upload. If you are using the EPIC system from Queens, the ACO quality team is going to send you that request I talked about a little bit earlier. They're getting ready to do that here in just the next few weeks. That request you need to fill out and return to them no later than February 28th to make sure you get that report in time to submit it into the QPP portal. We encourage you to not wait and do these things later. The sooner you can get them done, the better. We have seen some goofy things happen, both with the portal and with other parts of like getting the report or who knows what. We've literally seen people who are uploading data 10 minutes before the submission window closes on March 31st. And that's a whole lot of stress and anxiety for everybody that we would love to avoid. 2020 has had enough stress and angst of its own. We don't need to add anything else on. Okay. And again, if you have problems, the QPP help desk has longer and longer wait times as we get towards the end of March. So it's just a little bit simpler if you can. If you do not use EPIC from Queens, you use another certified electronic health record technology, ask your EHR vendor either how to get your hands on that QRDA3 report. Is that something that they run for you and provide to you, or is that something you need to run, or do they not have it available at all and you need to enter the data from a dashboard or from another report? Just make sure that you know how that's going to work and you have something you can save in your audit folder. If all else fails, save screenshots of the dashboard with the timestamp from the bottom right-hand corner of your computer screen. Okay, now let's talk a little bit about the submission steps. So when you go to qpp.cms.gov to get to the QPP website from CMS, up in the top right-hand corner is a sign-in screen or a little sign-in box. So click on the sign-in box, and then it's going to tell you the performance year submission reporting window is open. Now, because 2020 hasn't opened, we could only get a screenshot from 2019. So while this says 2019, you're going to be looking for the one that says 2020, and the 2019 submission window's closed, so there should not be any confusion. But I just wanted to point that out. Okay, so once you see this submission reporting window is open, there's a little button right next to it that says Start Reporting. You simply click on the button. You then click whether you're reporting as a group or you're reporting as an individual, and you select that option. Now, once you've decided to report as an individual or a group, now you're going to decide, are you going to manually attest or are you going to upload? So we're going to talk about the uploading process first. And remember, there's those three file types, a QPP JSON, QPP XML, or a QRDA3 report. A standard Excel report with your data is not going to work. Okay, so when you've picked group or individual, you'll get a screen that says Reporting Overview. And right here is a button that you can click on to upload the file. And there's a couple things that you're going to see. First of all, there's a reminder that the data is calculated immediately, and the system will populate with all of your data so you can see your preliminary score. Another important thing to know is that all of the changes are saved automatically. There's not a save button anywhere that you have to worry about. So don't spend a lot of time trying to find the save button. You put the report in, it'll put the data in there. When you can see it, the system has saved it. Okay, so once you get to the upload screen, there's two ways you can pull your QRDA3 or your JSON file or your XML file and put it in here. One is you can simply drag and drop the data into the little box here where it says drag and drop, or you can click browse and it'll let you browse your computer to where you have saved that QRDA3 file from your EHR system. Once you've dropped that file in or you've browsed and saved that file in, it will tell you, if you look here on the screen on the right, it'll tell you that your upload has been successful. We encourage you to take a screenshot of this page and keep it for your audit folder so it shows you uploaded data. And then you are also able to view the data and actually go in and see the data for every single measure. Like I said earlier, if there's a measure that you want to exclude because you meet those exclusion criteria, once you've uploaded the data, you can go in and manually change that. Okay, so that's how you upload using a file. Now let's talk about how you report using attestation when you manually enter that data. Just below the area where you click to upload the file, you will see boxes for each one of the 4 MIPS categories. And right here on the right-hand side is the Promoting Interoperability category. At the bottom of that, there's a Create Manual Entry button that you can click on. And when you click on that, it's going to walk you through the process of entering the data. So I'm not going to put in a series of screenshots to show you what that looks like, but I am going to tell you what those steps are. So the first step is you have to enter that certification ID number that we talked about back in the preparing section. You need that number before you can go any further. If you don't have that ID number, you're dead in the water right there. So you have to make sure you got the number. Once you put the number in, then you complete the attestation statements on the requirements of security risk assessment. Yes, you did it. Information blocking, and the allowing CMS access if they need to check on things. So those are the 3 things you have to check under attestation. And we can get you more information on exactly what those attestation statements are if you need. Once you've got that done, then the system lets you go and enter your actual performance results. The first thing you have to do is you have to put in the time frame for which you are reporting. And once you put in that time frame, then you put in the numerator and denominator for those measures that have a numerator or denominator, or yes/no attestations for the public health information measure. Again, just like when you upload the report, once you put that data in there, it is going to calculate your preliminary score after all of the data is in there, and you'll be able to see it's in there. Again, print a screen that shows you have data there in case you ever need to prove that. Okay, an important thing to know, you must report for a minimum of 90 continuous days, and you get to pick which 90 days you want, or you can pick any number of days up to the entire calendar year for 2020. So that's up to you. Maybe you did really, really good on getting all that data entered in the summer. Maybe you did really good with it when you have a lower patient population during COVID. Maybe you did better after everybody came back after COVID. Who knows? But you can go in, work with your EHR vendor to see which timeframes look the best. Those of you that use Epic from Queens, that ACO quality staff are going to help you figure out what's your best timeframe to report. Okay, now I am going to turn this over to Miranda to talk about what you do after your data has been submitted. Thank you, Miranda.
Thanks, Sharon. So after your PI data has been submitted, there are still things that you need to do. And I'll talk about each one of those individually. So once your data is in the QPP portal, make sure to take a screenshot of that data in the portal and at the time and date are attached. This you will want to save for the possibility of an audit. This may sound redundant because we have said take a screenshot quite frequently throughout this presentation. But we've all had those computer issues at least once in our life, and CMS is not exempt from that. When we recommend taking screenshots or printing and saving emails, it is to ensure that you are covering all of your bases and limiting the possibilities that your MIPS participation has an issue. For this, we always recommend the creation of an audit file folder. It does not have to be a physical thing. It can be an electronic file. What is important is that you have a single location that more than one person knows the location to and has access to and has all of your MIPS documentation. This is where you will want to save your screenshots and items that we recommend are in your audit folder would be your security risk analysis, screenshots of dashboards or important MIPS data from throughout the year, emails of exception approvals that were applied for, proof of reporting screenshots, contact information for the Queen support staff, and contact information for your EHR platform. Next, we are requesting that you report to the Queen support staff the date you reported, what your PI score was, and include the screenshot that you took. This is so they can track participation at the ACO level. And another thing that we are asking that you do, and it is another fall safe, is that we recommend prior to the reporting deadline, which is 3/31/21, that you log back into the QPP portal and confirm that your scores are still in there. Like Sharon said earlier, you want to take a screenshot saying your file upload was successful and you want to take a screenshot of your scores being in there. We recommend the second screenshot with your scores being in there. It sounds scary, but there has been situations when it comes to a targeted review where people will go in and look at their data and it's not there anymore. But with a clear case and having their pictures that they've taken, the screenshots, they were actually able to get their scores replaced and or reactivated, however you want to call it. And that therefore they were able to get the higher bonus. So, and then the last thing that we want to let you know is if there's any discrepancies or if there's any issues with your reporting, or if you have any questions at all that you want to either call the QPP help desk or you want to talk to your Queen support staff and they can help work through the issues with you. Like if there was an upload problem or if your scores did disappear or anything like that, feel free to reach out. They're here to help. Next slide, please. So we're going to go over the Promoting Interoperability Hardship application. 2020 is the first year that the application is actually in the QPP portal. You used to be able to access it through the qpp.cms.gov website, but for security purposes, they have now moved that within the portal. So that HARP account is very important because without it and access to your TIN's QPP portal, you won't be able to fill out this application. Next slide. As Sharon discussed earlier, there's a category of clinicians that are automatically accepted from reporting the PI category. This means that they do not have to fill out the PA hardship application to be exempt from PI. These clinician types and special statuses are automatically accepted from PI by CMS. They include physician's assistants, nurse practitioners, clinical nurse specialists, certified registered nurse anesthetists, physical therapists, occupational therapists, qualified speech language pathologists, qualified audiologists, clinical psychologists, and registered dietitian or nutrition professionals. And then there are also special statuses that will exempt clinicians from having to participate in PI. And that would be if you are ambulatory, surgical center based, hospital based, and non-patient facing. So to be able to see if you qualify for any of these, when you put your TIN into the NPI lookup tool on the QPP website and you expand the profile on your eligibility, it will let you know there if you have special statuses or not. You can also find your special statuses in the QPP portal once you've signed in with your HARP account. If a clinician has been automatically accepted or has been granted a hardship exception, they should not submit any data in the PI category in the QPP portal. If anything is entered in the PI portion of the QPP portal that includes a date or anything, an attestation to a security risk analysis, CMS will use this as a signal that the clinician is indicating the intent to opt into reporting the PI category. Likewise, if a clinician decides to report at the group level, they will need to include data from all MIPS ECs in the group, even if some of them have been accepted. So if you do have some clinician types within your group that are automatically accepted from the PI category, and you as a group have people that are required to report PI, if you group report, everyone has to group report, and those clinicians that were accepted lose their exception. Next slide. We just want to remind everyone that if you are slated to fill out the PI hardship application, the date is 12/31/20. That is the last day that you can fill that out. That's important to know because a lot of people get busy towards the end of the year and they might be focusing on other things. And if this is forgotten, you cannot go back and apply for it. This is a hard deadline. Next slide. So we're going to go over a little bit of how you log in and actually fill out the PI exception application. So again, you would use your HARP account to go to the qpp.cms.gov/login site. And that's right here in step number 1, we could see the sign in button. And then once you've logged in, on the opening page, you will see in the middle where it says exception applications. You're going to go ahead and click start an application. And then once that comes up, the next button you click, which you can do either where you see the circle with the add new QPP exception or the blue circle with the plus that says add new exception. Clicking either one of them will take you to the exact same place. Next slide, please. So there are going to be 2 types of exceptions that pop up when you do this. The first is going to be the PI exception application, and the second is going to be the extreme and uncontrollable circumstances application. We are strictly just going to talk about the PI exception at this point in time. So the first thing that it's going to ask you is to fill in the bubble for the PI application. Then it's going to ask you for data, and you're going to answer the questions as prompted. Under the reason for the promoting interoperability hardship, you want to select small practices. There are other reasons for a hardship application, but simply by being a small practice, you are automatically eligible for that exception. Next, you want to attest to the information that you supplied is correct. So, it's going to make sure that if you said that you're a small practice, that you attest, yes, this is correct. It's also going to ask you to supply an email address. We highly recommend that you supply your email address, and then they'll be asked for a second email address, and that you can either put in one of the Queen support team's email address, or you can do another email address from a person within your clinic. But the idea behind having the 2 exception emails is to make sure that you have covered all your bases, and that if you are or have been accepted for the PI hardship application, that you have proof that you were. So again, you want to print the screen of the approval message, which will actually pop up automatically on that application page. Then you will also get a follow-up email that you want to save in your audit documentation. And then also Queens can complete this PI exception application for you with your permission. So if you would like for them to do that, you just need to reach out. Next slide, please. All right, so next slide. So we kind of have a revolving calendar here you guys have seen before. So I just want to let you know that as things drop off, they will drop off this calendar, and as new deadlines are approaching, those will be added. We just want to make sure that you're aware that the QPP portal opens the 4th of January and it closes the 31st of March. We want to make sure that you're aware that mid-November you will be getting if you're using Queen's Epic, you'll be getting the form that you need to fill out to ask for your QRDA3. Obviously, the session that we're on today is on there as well. And then again, another reminder that on December 31st, the hardship exception is deadline. You want to make sure that you have access to your HARP account, and that this is also the deadline for the security risk assessment. So if you are filling out promoting interoperability data and submitting it, you have to have that SRA, and it has to be within the calendar year that you're reporting. You cannot complete it in the beginning of 2021 during the reporting period and then say that it's for 2020. Next slide. Sherry, would you like to go over the CME credit evaluation information?
I sure can. Give me just a second here.
Okay.
Okay, so in order to get the CME, you need to provide your contact information, and you have to correctly answer the first 3 questions of the evaluation. Hopefully we have stressed those and you will know the answers to that. And that will be popping up as soon as we close the session. Okay, next on the agenda is questions. I see we've had a couple of those in the chat box, so I just want to quick call those out. The first one was, can a small single doc practice without an EHR claim a waiver because of COVID-19 disruption for this year? If so, how? So how I want to respond to that one is I would encourage you to take the small practice exception that Miranda just walked through. Why the small practice? Because if you are a solo practitioner, you meet that standard without any question. There is the extreme and uncontrollable circumstances for COVID. We have seen a lot of people do that and it's accepted. However, we have no idea with audits what people are going to be looking for. And while we think it's going to be pretty straightforward, we have no reason to decide otherwise. Your status as a small practice is unrefutable. So that's the one that I would take. Just make sure you're not on that list from Queens. We'll show that in Appendix A here in just a minute. Another question that I had from John was that his QPP login access was denied due to the need to update to the newest version of Chrome. And that is something that we are seeing, that to use the QPP portal, you have to have some of the newer versions of the web browsers. So if you haven't done that, please do so. He says after doing that, he still had an error message. Do I need to update password or recover his account? I don't know the specific answer to that. I refer you to that QPP help desk number. I would go to that site, go to where you're getting that error message, have that error message on your screen, give the QPP help desk a call, and they should be able to help you walk through that. I have no doubt there's a lot of people bumping into that. That's how you can help get that addressed. So let's see. Do we have any other questions out there from folks? Okay, a couple of questions that we have answers to. Who should you contact if you have questions? You want to get a hold of Jade, Stephanie, or Kelson, who are all on this today. They are your Queens Quality Practice Assistants, and they will be able to help you. If they bump into questions that they don't know how to answer, they reach out to us, and we're happy to help them. The next question is, what should I do if I'm showing 0 in the numerator and in the denominator of receiving health information? We find receiving health information is one of the harder measures to meet. So the first thing you want to do, you want to get a hold of your EHR vendor and make sure that one is set up correctly and have them tell you what your direct email address is so you can provide that to Queens and they can do some testing, some sending of referral stuff to make sure you get information in there. So if that one's at 0, that needs to be looked at right away. Okay, any other questions? Okay, if no questions, we do have links and resources on promoting interoperability. These are in the slide deck for your help. We also have an acronym list that gives all of the different acronyms that we use. We try to make sure that initially we say it out loud at least once, but this is pretty acronym heavy topic. Okay. Okay, we have our contact information, and here is that list of the practices that are scheduled to report PI data. Those folks that are in the Queens ACO, who Queens is planning on you, or the ACO is planning on you reporting that data. So if your name is on here and you thought you were taking the exception, you need to talk to Queens. If you want to report data and your name isn't on here, you want to talk to Jade, Stephanie, or Kelson, and they will help you with that. So, and then lastly, we have Appendix B, which has a list of the different things you'll be filling out to get the information from Queens Epic for those that use the Epic system. So that is the end of our session today. I want to give Stephanie, Kelson, Jade, or Laura the opportunity to jump in and say anything if needed. So anything that any of you want to add before we close the session, or any further questions?
Hi, this is Laura. I'll be very quick. Just reiterating what you mentioned earlier about that if you want to review this session, or if you want to have other colleagues or staff watch the session, it'll be on our website, qcipn.org, in a week. And if you have any issues with logging in, because they're all individual logins now, just reach out to us. You can do qcipn@queens.org, and I can get that information for you.
Thank you.
Thank you, Laura. This is Stephanie. I just wanted to just kind of reiterate what you said again. If anybody has any questions, please feel free to reach out to myself or Jade. And then you have my email address on there, snobriga@queens.org. Just reach out and then we will try and get your questions answered. But thank you.
Okay, with that, and not seeing any further questions, we're going to give you 8 minutes back in your day. Thank you for attending today, and the evaluation will be popping up as soon as we shut this down. Have a good one. Bye-bye.